Becoming a parent is more than just simple words. It's a complete change as a person. Physically, mentally, and emotionally, you become different. But when I became a parent, it felt like everyone else knew better than me. And that happens to most, especially when you're tired, overwhelmed, and constantly second guessing. You might even feel silly for worrying about certain things, or unsure whether you should speak up. But I want to say this very clearly: your instincts matter. My wife is not a healthcare professional, and her gut feelings have always been smack on. She spent more time with my baby than anyone else, and she was able to notice subtle changes that others missed. So if you ever feel something is amiss or something feels off, it's absolutely okay to check in and ask for help. Seeking reassurance doesn't mean you're anxious, overreacting, or doing something wrong. It means you're being a careful and responsible parent. At the same time, it's also helpful to know that many newborn behaviors look very dramatic, but actually are still normal. However, that balance between trusting yourself and understanding what's normal is what brings confidence. So, how do we decide when to watch and wait and when to get checked, you may ask? Well, let's go through the red flags we look out for as a doctor. These red flags are not here to scare you, they're here to give you clear safety boundaries so you don't feel alone with your worry. And before we start, remember this: most newborn worries are normal, and most babies you worry about won't have any of these. Red flag number one is feeding dropping off significantly and quite suddenly in a short span of time. That means your baby is refusing feeds repeatedly, feeding far less than usual for them, or you can't get them to take enough despite trying. Red flag number two is concerns about hydration and liquid intake. If you're seeing far fewer wet nappies than normal, very dry lips, or your baby seems dehydrated, that's a reason to get checked. Red flag number three is vomiting. That's more than a simple spit up. Spit ups can be normal, but repeated forceful vomiting, vomit that's green, or vomiting with a very unwell baby needs urgent review. Red flag number four is a baby who's unusually sleepy or hard to wake. If your baby is difficult to rouse, not waking for feeds, or feels floppy and unusually quiet compared to their baseline, get them checked. Red flag number five is changes in responsiveness, how they react to external stimuli. For example, if they're not making eye contact like usual, not reacting to your voice, or their responses feel reduced or absent, that matters. Red flag number six is breathing difficulty, not just breathing noise like the ones we covered earlier. That means struggling to breathe, breathing very fast for a sustained period, pauses in breathing, or pulling in under the ribs when they breathe. Red flag number seven is color change of their skin. This can be the whole body or just certain parts. For example, your baby looks blue around the lips, very pale, gray, or mottled, and it isn't quickly settling. That needs urgent review. Red flag number eight is persistent distress or irritability that you can't settle despite things that usually would settle them. That means crying or discomfort that doesn't improve with feeding, holding, changing, or comfort, especially if it's new or escalating. Red flag number nine is a fever or temperature concern, especially one you cannot reduce with Calpol or usual children's medicines. If a newborn has a temperature or feels unwell with temperature changes, it's always worth checking because newborns can get unwell quickly. Red flag number 10 is a sudden change that comes with other symptoms. Let me explain. A behavior change on its own is often normal, but behavior change plus any of these above is different and can be worrying. Yeah. So, the way I want you to think about red flags is patterns and combinations rather than one small moment. And if you're ever unsure, trust your gut and ask for help because reassurance is a valid reason to be seen. In clinic, I would always rather you come in early and leave calm than sit at home worrying by yourself. It's not fair on you, and neither is it on your child, because the truth is, you're definitely doing better than you think. But any doubts, we're all here to help.